Firstly, what we wanted was a system that was all in one, so we could triangulate a lot of our incidents, but also with our risks and our audits.
We have used different systems, but I think what we've got with Radar Healthcare is the ability to bring all our incident management, safety alerts, audit programme all into one place, so we have one clear action plan for our staff. It gives me really clear oversight of all the activity across the 53 hospitals that we have within Circle Health Group. The analytics are absolutely amazing within Radar Healthcare, so I can pull reports, I can filter them, I can really pull out some key messages that I want to share across the group.
I am a self-proclaimed geek, so from an analytics perspective, I'm really keen on utilising that platform and bringing that triangulation to life.
It gives me more assurance around the data quality, and to be able to bring all that together for our team meetings has enabled us to be more efficient in the way that we work.
It really sets the tone at the start of the day. It's really allowed us to use our time better. I'm working the same amount, but my outcomes are much more measurable. You're able to see much more of an impact, so it's just helping us work smarter.
I think it's been massive for us. When you are moving from 12 different ad hoc systems, it brings a lot of stability to our sites to know that they've got all of these things in one place.
We started to transition to Radar initially for audits and incidents, and then it's grown more since then. There was a noticeable difference between how we were using incident outcomes, how we were using audit outcomes right at the start when I first came in versus how we're doing it now. I've seen a massive growth in productivity following all of these governance systems.
The Patient Safety Incident Framework was put in as an NHS directive, and that essentially means that we've moved away from the serious incident framework that was into a more streamlined, proportionate and patient-focused way of investigating patient safety incidents. There's less big investigations at the most significant end of incidents, and that more of those incidents are managed locally by sites. Simon and I managed to work together to develop a bespoke system where PSIRF is built into the algorithm. So PSIRF is embedded in everything we do within Radar.
The ability to link incidents and complaints, and also the ability to tag things we can put actions on, particularly in relation to place, so we can take them to the Clinical Governance Committee.
What our teams have really noticed is the vast improvement in the safety culture that's come from using Radar, and how we're really able to hone in on lessons learned, and then from that you generate really meaningful quality improvement initiatives.
We could see more of what was going on underneath instead of just seeing the output of an investigation. We can see the contributing factors, and because that's embedded within Radar, I can compare one investigation to another investigation, and we can better identify themes across a group of investigations. The unexpected thing is that not only have we regained our former position in terms of the level of incidents reported, but we've exceeded it. So we've seen a significant increase in our data sets in terms of incident reporting, but equally we've seen a significant decrease in those incidents that are going to the highest level of investigation, patient safety incident investigation, as opposed to root cause analysis has decreased.
Within our Clinical Governance Committee, we review the risk register live to look at our key inherent risks and our responses to those. All the key people from the Clinical Governance Committee are able to review those all together in the same place, in the same room.
We can see exactly what the site have written, and even if they've updated that 5 minutes before, we can see that with as much real-time information as is possible.
Radar Healthcare has really helped us to capture positive outcomes from feedback, from compliments, and also the positive outcomes from incidents where things have been managed really well, and it allows us to capture the positive elements to feed that back to staff.
Being able to reflect on what's gone well and learn from those, the psychological burden that can lift off someone's shoulders can be really impactful, really.
I think the ease of use of Radar Healthcare enables us to really drive home our open and transparent culture of reporting. Our staff don't feel uncomfortable about reporting incidents, so that's always a good thing.
The project team from Radar Healthcare have listened to any areas for improvement we've considered and have supported implementation of those changes in a responsive manner.
always happy to have calls or Microsoft Teams calls rather than just respond over email. Sometimes it helps to just understand the problem a little bit easier. Radar have shown that they are very keen on understanding what works for us at Circle Health Group. It really became apparent that there was that technology partnership.
I would recommend Radar Healthcare to other organisations. I think the support that goes behind the implementation of the system, the training, the education for our teams, making it easy, making it simple. I love the dashboards within Radar Healthcare. I love the analytics side. I love the pulse. I get an alert, so then I can then really focus my attention on that because it's gone over a threshold that I don't want to go beyond. It enables me to be more focused and efficient in what I do.
Everybody comes to work to want to improve the safety of their patients, and that's something that we're doing much better now that we're engaging with Radar.